Okay, so welcome back everybody to our dengue side meeting here as part of the ongoing UNGA75 days that we're kind of celebrating here. You've heard from the previous session how important community is in terms of the vital asset for vector control activity, especially given the impact of social distancing and the new reality of COVID, and the kind of measures that some of the governments in Malaysia, Pakistan have taken to counter the anticipated impact to vector control activities. All the presentations we had really pushed home the message that it's all about the community engagement, mobilization, and really centering those in terms of any kind of future control activity in dengue. That kind of leads us on very nicely into the second session. And we're looking here at vaccine hesitancy, dengue as a kind of a case study of when things happen in terms of mistrust and hesitancy, and then the case for rebuilding trust within those communities, and what can we learn from the dengue experience and channel that into a more positive outcome for any anticipated COVID vaccine uptake. The word community was used very, very heavily, as I mentioned in the first session. The issue that we're seeing across the world here now is that vaccination programs, public health programs, are underpinned by trust by the community in that vaccination program, in that public health program. When that gets eroded, people are not going to be compliant to any social distancing measures. It's going to be a lot of conspiracy theories. There's going to be a lot of negative energy in terms of trying to get those communities in a sustained, engaged manner. This whole area of vaccine hesitancy is absolutely fascinating. And I'd like to say that we're very proud to have our first speaker, Professor Heidi Larson from the London School of Hygiene and Tropical Medicine, founder of the Vaccine Confidence Project. I'm going to hand over to Heidi in a second, but before I do, the other panelists that you can see there, to my right, we've got Dr. Derek Wallace from Takeda Pharmaceuticals. Hi there, Derek. The program head for dengue there. We've got Dr. Angus Thomson, who's now advising at UNICEF to give a bit of the perspective of their perspective in terms of their approach, some tool sets that he's working on. Professor Lulu Bravo, all the way from the Philippines. Good evening to you. You're probably hating us because of the time zones. Lulu, very, very good to see you again. And Jean-Antoine, Dr. Jean-Antoine Zinsou, the country head of the Philippines for Sanofi. Very nice to see you there as well, Jean-Antoine. So without further ado, I'm going to hand over the floor and say a round of applause for everybody. Thank you. And over to you.
Okay, good afternoon, everybody. It's my pleasure to be here and participating in that discussion. I thank the organizer for giving me this opportunity. When I was asked to present on vaccine hesitancy, I have two options. Either I share with you what Sanofi Pasteur is doing globally, or I decide to just focus on what we are doing here in the Philippines. And I thought it would be more interesting to have this specific case of the Philippines. And this is why my presentation or my talk will be just on the situation in the Philippines. But before getting into the details, I just want us to remember the correlation between vaccine coverage and the vaccine confidence. On this chart, as you can see, you have the vaccine coverage rates for most of the vaccines of the EPI in the Philippines, and from 2016 to 2020, but we will stop at 2019. And when you look at the trend, you see that it's decreasing. The vaccine coverage is decreasing over the years, and it hasn't started in 2016. In fact, for more than a decade, the vaccine coverage rate has been decreasing to the lower to reach the lower level in 2018. And as a matter of fact, in 2018 is when we had the lowest vaccine confidence among Filipinos. We had a vaccine confidence of 32%. So there is a direct correlation between the vaccine confidence and the success of the vaccination programs in the country. But when you look at what's happened in 2019, you see that the country is somehow recovering a little bit. We have an increase of the coverage rate, the vaccine coverage rate in most of the vaccines of the vaccination program. And I guess this is due to the effort of the government to increase the awareness and to advocate for vaccination, but also to the efforts of the company like ours and the civil society to increase the awareness and to advocate for vaccination. So when it comes to Sanofi, what we decided to do is to have a three-pronged approach to combat vaccine hesitancy. First, it was important for us to listen what people have to say, to understand what were their constraints, what were their concerns. And therefore, we opened this web page in which they could post their questions, their queries, their recommendations, their advice, etc., etc. But it was also important for us to emphasize the need to have science-based communication. We wanted to have this science close to the people for them to understand what was the ground of vaccination. And we didn't limit ourselves to specific parts of the society. We wanted to have a whole of society approach in order to make sure that we have this raising awareness and this common advocacy in favor of vaccination. And all the examples that I'm going to share with you are based on these three approaches. I must confess that when we decided to listen to what people have to say, we were a little bit anxious because we were expecting a lot of questions around the vaccine controversy, the dengue vaccine controversy. But as a matter of fact, all these questions on the dengue vaccine controversy represent only 2% of all the posts that we listed on this web page. In fact, 69% of all the posts were related to general health concern on rabies, on different diseases, flu, is it the same as common cold, etc., etc. But also 25% of these posting were related to the procurement of the vaccine, where they can find some vaccines if the health center close to their house were capable of providing them with such or such vaccines, etc., etc. So all in all, we realized that people had really basic questions on immunization, and they were looking for reliable information in order to make up their mind and to have a well-informed decision-making process. And it is so valuable to have this insight from the Filipinos that we decided to keep on with this interaction, with this, pulse taking of the Filipinos through a constant polling. And with this polling, we have different questions. This survey, we have different questions that are asked to the Filipinos from, their preference in terms of vaccination centers, which vaccine should be administered to who, etc., etc. And thanks to this knowledge, we are able to shape the message that we want to convey through the different webinars, etc., etc. So it's extremely valuable to start with, like we say, a mapping of the needs of the population that we are targeting. And then you have to organize the communication, the communication around the science. And we have a couple of initiatives that we are very proud of, one of which being Farm Healthy. It's a partnership with the Asian Parents Association. It's a webinar that we organize, and we have experts in contact with the families, with the parents. And through this webinar, we have this dialogue between the parents and these experts. And this has the advantage to really address the concerns of the parents, but also it, I would say, quote unquote, teach the experts to abandon their jargon and to speak in the lay public language. And this is very important. When you want to pass this type of information through, you definitely need to abandon the scientific jargon for people to understand. And it's amazing because through these 9 webinars that we already organized, we've been able to reach hundreds of thousands of families. And some of them, organize watch parties, did some posting, and organize also Instagram stories that they share. So all in all, the outreach of this initiative is over millions of Filipinos. And I think this is a very nice way of providing people with reliable scientific information. But as we were, checking what was the need of the population, we realized that for the media, it was somehow complicated to get access to, the slide is not moving anymore. Okay, to have access to scientists. So in partnership with PHAP, which is the Pharma Industry Association, and with the Philippines Foundation for Vaccination, we launched this initiative, Health Connect. And Health Connect, really, it's an initiative through which the experts can discuss a topic with the journalist. And actually, this morning, we had a session that was, shared by Professor Lulu Bravo. And I mean, you cannot imagine how successful it was. It was scheduled to last 1 hour, and we have to extend it to 2 hours. And there were 50 or so journalists, top-ranking journalists and not that known journalists, all together asking questions, showing their interest for the real science. And this is really encouraging when you have journalists who pay that level of attention to the science, because it can be reflected in the articles that they're going to write after attending such meetings. But of course, we live in a digital era, and therefore we need to take advantage of all the tools that are available. And this is why, for example, we partner with some bloggers. We have one blogger who used to discuss health matter with moms. So we partner with her to organize some discussion on health matters. We also have a partnership with a journalist who is inviting followers to follow a health journey, and we seize this opportunity to share with her some critical information or scientific-based information for our followers. Another initiative that we have is a pledge for the Sanofi to be perceived as a partner or a companion of each Filipino on their health journey, their lifelong health journey. It is important for us to be perceived as a reliable source of information, reliable source of products. So all in all, we have this kind of holistic approach, which wouldn't be complete if we didn't target the future generation as well. We have to include the future generation, and this is why we decided to engage ourselves in a partnership that is called an initiative that is called the Youth Health Patrol. This initiative is run in partnership with the Department of Education. In a nutshell, we have 21 schools together, and the students are supposed to increase the awareness of their community, of their peers on a specific topic, and to engage themselves in activities to advocate for this topic. And in 2019, if you remember well, in the Philippines, we had this massive dengue outbreak. So the theme was how to support the 4S strategy of the DOH in their schools, but also in their community. And they had also to conceive a Facebook page where they were promoting the 4S strategy. So as you can see, we get involved in topics where we have no interest, I will say, because I mean, we don't have any dengue vaccines available in the Philippines, but this is part of our public health commitment. We are committed to support the health authorities in the attempt to promote the right behaviors when it comes to prevention of these infectious diseases. It has been extremely successful, and by unrolling this type of initiative, what we aim at is really to have a new generation of youth. So the Youth Health Patrol, in fact, is a community engagement program that aims to form a peer-to-peer coalition of health champions. Through knowledge sharing and design thinking, we hope to encourage public school students to become health patrollers, whose task will be to mobilize campaigns that create awareness around solutions to health challenges in their community. So this has been extremely successful. And as you can see, all our initiatives are targeting different components of the community. And through this last initiative that I'm going to share with you, what we aim at is really, oops, what's happened? Oh, there is something wrong in the.
No, we can still see you and hear you fine, Jean-Antoine. Your whole of society slide, it seems to be working fine.
Okay, on my side it's not working fine, but okay, if it's working fine, what we did, we also, okay, no, it's not working.
I can move the slides for you if it's easier. If you just say next slide, I'll move it. Okay, so there seems to be a slight glitch there in terms of connection to the Philippines. Jean-Antoine, yeah, you're back with us? Yeah. So Jean-Antoine, if you want, I can press next on the slide if it's easier.
Can you see me now?
We can hear, yeah, we can see you. You're there. You're there.
Oh, sorry, I don't know. There's been a technical problem here. So I was saying that, as you can see in the different initiative that we are launching, we try to reach every component of the society, and this is why we are also supporting this Health for All initiative, which is a coalition building campaign that's bringing together engaged citizens and healthcare experts, as well as non-medical professionals who can contribute to the country's health outcome. And the objective is to have this dialogue between experts and non-experts to together design solutions for some of the issues the communities and the cities are confronted with. And thanks to the COVID-19, we have a very good portal of entry to elicit some interest, because I mean everybody in the community is talking about COVID-19, is concerned about COVID-19, is talking about the arrival of this vaccine, etc., etc. And we plan to have a range of events and activities really to put all these issues in a health ecosystem in which everybody will contribute to the appropriate solution that will apply to the community. And this coalition is led by Make Sense, which is an NGO with a lot of expertise when it comes to mobilize toward access to healthcare and other health or social advocacy issues. So as you can see, what is important for us is to make sure that we have all an holistic approach of this fight against all these misconception, misinformation. What we want to do is really to build a healthier Philippines through a sharing of the right information, the scientific based information. And as a matter of fact, we think that nowadays with this COVID-19, even though we have a direct benefits of the COVID-19, which is a raising of the awareness of the people in the value of vaccines, because as we were mentioning before, we have an increasing demand in flu vaccines, an increasing demand in pneumo vaccines as well. But now, more than ever, we definitely need to work together to combat misinformations, especially when preparing the community for the arrival of the COVID-19 vaccine. Misinformation is definitely one of the more potent sources of vaccine hesitancy. Anti-vaccine groups are very, very, very active nowadays because they took as an alibi the fast tracking of the development of the COVID vaccines. And they are also supported by the conspiracy groups who constantly wall their audience against the underlying mission of the COVID-19 vaccine. So definitely pro-vaccine, we need to be more active, more structured. We need to have a systematic approach in tackling misinformations. We need to have this holistic approach. And when it comes to dengue, it's very important to have opportunity to share the right information on both the solutions, whether it is vector control, whether it is vaccines. We need to be able to have our voice heard by the community. And I think that having a World Dengue Day will contribute to the spread of the right information, the science-based information. I think health authorities, the scientists, pharma industry, civil societies should all join forces to help journalists, thought leaders, and lay public to clearly perceive the value of vaccination. We need to have altogether this holistic approach of the community in order to make sure that we win the battles against vaccine hesitancy. And I think this is my last slide. And I just want to thank you for your attention.
Well, thank you very much for that, Jean-Antoine. An amazing journey in terms of your experience in the Philippines, and how what's very encouraging is the robust nature of your engagement with the actual communities themselves. You mentioned quite a few touch points there in terms of Department of Education, the journalists. I'm sure that'll crop up in the questions towards the end when we have our panel discussion at the end. But thank you very, very much for a very enlightening presentation there, and a round of applause for that. I'm just going to try Professor Larson.
I'm pulling the lens back a little bit to look a bit more at trends and the bigger picture surrounding this. I kept hesitancy in the title because that's the title of the session, but we've opted for the term confidence, because we want to give it a slightly more positive spin, but recognizing that there's a broad spectrum of kind of zero confidence to 100% confidence, and hesitancy is living somewhere in the middle, recognizing that hesitancy can be impacted by access and other issues too. But we particularly focus on confidence. Well, this is last month we launched a pretty big paper, published a pretty big paper with the Lancet. As a number of you know, we started running what we call the Vaccine Confidence Index. It's 4 key domains on confidence in the importance, safety, effectiveness, and compatibility with religious beliefs, with a lot of demographic and other questions asked to give some context to what people are thinking and feeling. But what we did, and one of the reasons we started this index, was not just to capture point in time, but to really see how things change. This does not give the detail on why they're changing. What it does is flag where there are changes, so it alerts the system to say we need to do a deep dive here and figure out what's changing the confidence weather, as it were. But because we can't be doing deep dives all the time everywhere, this is kind of helps with triaging where we need to focus our more in-depth efforts. Between 2015 and 2018, this is with 149 countries and about 285,000 respondents. The good news is that, and frankly, because I think the immunization and public health community recognized that we were starting to have some challenges that we needed to address. There were various efforts. I remember a meeting that Angus and Mike Watson convened that I had the opportunity to be a part of in 2010 already. Then in 2013, there was, SAGE launched the Vaccine Hesitancy Working Group, and there was a growing momentum of attention. And I actually think all that attention has paid off in the sense that we can start to see that the confidence weather is changing. Now, it's quite a spectrum. I mean, this is effectiveness in one axis and safety in the other. But we do see India and Uganda are doing quite well, Japan consistently lower. But a number of the reasons for this is specific events that have happened. France has consistently been also lower in Europe, but the Philippines is hovering just about over half, both with effectiveness and safety. But it had a big dip in the middle here, but then as we heard, is coming back. Now, in the difference, one of the things we see that's different and important to pay attention to is that people are much more likely to be positive about the importance of vaccines than they are about the safety. Pretty much consistently around the world, higher levels of importance than safety, and effectiveness tends to be between the two. But a positive trend here, the dark red, the orange, that's not those who don't agree that vaccines are important or safe. And you can see that's faded out much more to the blue, more so for importance than effectiveness. But safety is still struggling in the sense, because we still, as you see Europe remains kind of quite skeptical about the safety of vaccines, both France and Eastern Europe there, but in other places. And we do see some places like in North Africa, a number of countries in Africa that were actually more positive are becoming less confident. That's not a good trend. And we do see that Australia also here dropped a bit. But the point of all this is to say this is not a stable ecosystem. It's very volatile, it's fragile, and it needs constant nurturing. I was very happy to see the focus on listening, engaging, and dialogue. I know this is something that Angus has also been promoting for a while. But and that kind of engagement is so crucial. I mean, we need these bird's eye view to see the direction of things, but it is kind of, we need to be keeping our eye on the horizon at the same time while we're working locally, because in the last couple decades, the immunization community has made great trend towards, not just doing top-down global to local, recognizing local, but now because of the high connectivity in the global environment, especially with social media, we need to be both local while keeping our eyes and ears for things that come from other countries, pieces of information that create anxieties. We've heard about, so this is just the Asia part of a figure in our new study, and it's looking at the absolute. Oops, you can't really see it. The absolute drop in confidence changed, the change. It's about how much change there is. And the Philippines and Indonesia were the two countries in Asia that had the largest drop. It doesn't mean that there aren't countries that are lower, but the difference between 2015 and 2019. And certainly in Indonesia, we know that there was quite a proactive Muslim fatwa and a few Muslim leaders calling attention to what they felt was haram, not religiously compatible MMR vaccines, and that created a lot of tension and drop of confidence. In the Philippines, as you know, you all know and heard a bit, there was this acute politicization of dengue vaccine. Now, what's interesting to me, in the top 5 issues and events of 2018 that had the most fake news online, dengue vaccine was the number 2, in the middle of largely, you know, political issues. I read an article in Le Monde, I think it was last year, that was saying it used to be just the Gilets jaunes in politics that you don't talk about at the dinner table, but vaccines have become the new topic not to talk about at the dinner table because of the politicization of it. And this is one of the risks was also the timing in the context of political elections. We've seen that in other countries, which are high risk for becoming politicized. We did the study, which I think that Jean-Antoine, your reference to dropping to 32% was from this study. Because we had the global baseline from 2015, when the announcement of the small risk of the dengue vaccine started to become politicized and amplified, we reran the confidence index and found that there was a very significant drop. 2015 is the lower bar here. Some of you have seen this. 2018 above, but if you only look at how much more red, which are do not think vaccines are important, do not think they're safe, do not think they're effective, and don't even think they're compatible with my religious beliefs, that has became much more less confident, less trusted, quite significantly between 2015 and 2018, which but what was fascinating to me was that it even had an impact on what people felt was the compatibility with their religious beliefs. It says to me, one, about how much religious sentiment is about the interpretation, but how the values, the importance of values in these, science, getting it clear and less jargony is absolutely crucial, but also somehow relating to what people value. And they put their trust in the system. And that trust was broken. And it didn't align with their values that were part of their religious beliefs. So it wasn't the specifics of the religious text, but the principles and the values. The Department of Health recognized that part of this vaccine hesitancy had a knock-on effect with measles. It wasn't the only reason, but there was a climate of hesitancy. The other thing that happens, and we've seen this in different settings, that when you do have an event with one vaccine, you get other players who jump in with an alternative. They're going to want to have something to protect them from the virus, from the disease, but if they're not going to take the vaccine, I've got the solution. So we also saw that in Indonesia, that when the fatwa and the sentiments discouraging vaccines as not being religiously compatible, there was a reemergence of some traditional healers coming to the fore to say, we have something else to offer, reaching out to listening to the people and appealing to them in ways that some of the examples from Jean-Antoine's presentation, that kind of appealing approach is really important. This you've seen before. The other thing was the polio outbreak. So I just bring in all these dimensions because as we anticipate a COVID vaccine, I think we need to think, there was a whole issue in the Lancet, I think it was last year or the year before, on syndemics, the multiple pandemics and multiple outbreaks of disease. And I think that one thing in the context of COVID, there's so much uncertainty, whereas childhood vaccines, even the flu vaccines, a pneumonia vaccine, these are familiar, known. Both the disease is much more known and the vaccines. The more we can start to bring back some familiar things, there will be opportunities to start talking about a COVID vaccine. And also they'll reflect the fact that there is caring, the health authorities and others are caring about other parts of their lives. And I think that was also mentioned in some of the efforts we just heard about at a local level. Our latest, we just have some even more recent data, and then we've also done some projections based on that. As you can see, the confidence is coming up, and that's great news. We did multiple waves of after that first measurement of the drop in confidence, we did multiple waves of the same survey as the ministry and other actors, health authorities, NGOs, and Sanofi. I mean, multiple players came in to try to rebuild confidence. To use that as a metric that help see people that actually, wow, our work, our efforts are having an impact. They were incremental, but they were going in a direction that helped motivate people to keep working. And I think one of the other things about the confidence building, since rebuilding trust is a theme of our session here, is not to just focus on confidence or believing in a specific vaccine, but a lot of the meaning around it. And I think one of the positive things and approaches with the ministry or the health authorities, the immunization program, was to focus on rebuilding confidence in the program, not specifically on the vaccine, because the trust was broken to the point that other health interventions were being taken. And that was something that was, I think, absolutely the right decision. And certainly we have the evidence that it's been working. This is our website. We've has a slightly different face now because we're very much doing a lot in the COVID space, but thank you very much. And sorry for the earlier technology delay. Thank you.
Thank you very much, Heidi, for that. Fascinating charting the dip in the Philippines and then the rebuild process to where we are now. And it kind of really augmented the previous presentation by Jean-Antoine, some of the concrete steps taken at community level. Fascinating. Well, I wonder what's the initial trigger for the misinformation. What is it's like a vacuum of people not speaking about it, the science professionals not speaking about things, and the vacuum that's created, suddenly it all kind of just goes into this misinformation space. But I'm sure you're going to get a lot of questions when it comes to the panel discussion at the end. Thank you very much for that. I think we're going to move to the third speaker, Professor Lulu Bravo. Professor Bravo is Professor Emeritus at the College of Medicine, University of the Philippines, Manila, and is the closest thing we've got to a celebrity scientist, because I think everyone in the Philippines who's involved in vaccinations knows of Professor Bravo, and especially in the wider Southeast Asia region as well. So a round of applause, and I'm going to hand you over to Professor Lulu Bravo. Thank you.
Okay, thank you very much, Kamran. I get this feeling that we are talking about the Philippines. Thank you, Dr. Heidi Larson, for really focusing on the Philippines. But I do believe that we are really going for a lot of vaccine hesitancy and confidence. So let me begin by just, as usual, putting out my disclosure. I've been doing a lot of vaccine trials for the last 30 years. I'm not that old. The objective of this presentation, which I entitled World Dengue Day, Recognizing Dengue as a Global Threat. The objective is really to highlight dengue as a disease that has been the scourge of tropical countries in the Asia-Pacific region where it was originally recognized. This disease is unstoppable as it spreads its ugly head in other parts of the world, Africa, Latin America, and even some parts of Europe, making it a global threat as WHO declared this in 2019. We are here to show you how trying to find the solution for its control and prevention through a vaccine has led to another serious problem, and that is vaccine hesitancy in a country with one of the highest, if not the highest, burden of the disease in the world today. You know, it was in 1954 when the Philippines first reported in the Philippine Journal of Pediatrics many cases of flu-like illness in children, followed by bleeding, shock, and death within a few days, and was initially called Philippine hemorrhagic fever. It was later identified as being caused by dengue, a flavivirus that is mosquito-borne and has 4 distinct serotypes that can produce separate infections in the beginning. In the beginning, dengue had a high case fatality rate, which ranged from 0.10 to 2.0%. But with improved and appropriate management over time, specifically fluid therapy, the case fatality rate started to decrease to as low as 0.01 to 0.5%. However, the morbidity and very high hospitalization rates remained very high, especially during outbreaks, usually occurring during the rainy months. Through the years, there has been a significant, why is it not moving? Is it moving? Through the years, there has been a significant increase in dengue incidence cases throughout Asia, with cases being seen in many tropical countries, and of course, Southeast Asia and Latin America becoming highly endemic for dengue. It is now estimated that half of the world's population could be exposed and may be at risk. 390 million are infected every year, with 80% asymptomatic, but they can still transmit the disease. And deaths from dengue, as you know, is estimated around 20,000 yearly. In my country, that's the Philippines, reports of incidents in the last 20 years may have been erratic and underreported, mainly due to surveillance capabilities and lack diagnostic laboratories. Nevertheless, in the last 10 years, it has been shown that the incidence has increased significantly with the increase in population, urbanization, and mobilization. In 2015, a staggering 200,000, I wonder, it's not moving. Is it moving? Yeah, in 2015, a staggering 200,000 actually was reported, and that it was made clear that the peaks of dengue incidence is just going to be higher every year, every time there is an epidemic or outbreak, and this usually occurs in the months of August to October. The control and prevention measures for dengue have been in place, namely environmental cleaning and removal of mosquito breeding sites, plus vector control. They have all been practiced, and government was always ready to implement what we call the 4S, which was also mentioned by Jas earlier. The measures including search and destroy breeding places, self-protective measures, those are SS, meaning seek early consultation and say no to indiscriminate fogging. However, nothing really proved to be able to contain dengue. And year after year, it gets to be worse with people just trying to live with the virus and the mosquitoes, just as what we are now doing in COVID-19, living with the virus. And then something happened in 2015. The long-awaited demand for a dengue vaccine as the most effective measure to prevent dengue came to be introduced after being licensed both in Latin America and by the Philippine FDA. We know that vaccine development has been started as early as the 70s and continued on. But finally, in 2015, a dengue vaccine was ready for use. 2 countries, the Philippines and Brazil, began to use this vaccine in a limited mass vaccination program following its licensure. For one country, however, and that's the Philippines, with more than 800,000 vaccinated, its introduction in 2016 was marred by serious political upheavals leading to public distrust, a scandal that made the vaccine perceived to be unsafe and compromised not only the immunization program of the government, but other health programs as well, such as nutrition, deworming, and this is with loss of trust in government health officials. There was subsequent indictment of health officials, and they were being charged with negligent imprudence resulting in homicide. Of course, this could and never would be proven, I believe, and some have actually been dismissed already, but the damage was done. It was inevitable that almost overnight, the Philippines became the most vaccine-hesitant country in the region. Vaccine confidence, as Dr. Larson has mentioned earlier, plummeted from 93% in 2015 to 32% in 2018. Political figures and grandstanding groups and individuals took advantage of and used misinformation, fake news, and disinformation for their own self-interest and agenda. The dengue vaccine license was finally withdrawn in the country in 2019. Even after due investigation and a WHO recommendation that says that the dengue vaccine can be used in countries with high seroprevalence. And the Philippines has more than 90% seroprevalence for dengue, by the way. And even with appropriate serologic testing, despite appeals and position papers made by medical societies and academic communities, the FDA was not able to renew its certification. The reason being given was late or non-submission of paperwork, and not really because of any safety concern. The way that media and various interest groups demonize the vaccine and the people behind its introduction could probably be a good lesson in how not to introduce a vaccine in the national immunization program during an election year. Or this could be lessons in wrecking and breaking up a good vaccine and a good company. Politicalization, emotional responses, unsubstantiated figures, and media amplification brought down the vaccine to its knees and all the well-meaning people with it. Just look at these numbers of media coming out on a daily basis, and not yet counting to social media and the trolls, which made it worse. Came 2019, and the Philippines was hardest hit with more than 400,000 cases and more than 1,000 deaths, which was like a karma for us. We know, of course, that the dengue vaccine remains licensed for use in all other 22 countries, including the US and European region. And we have well-to-do patients actually traveling to Singapore or Thailand to get vaccinated. So, for all of you there, this dengue story is a never-ending one. And the continuing saga of a disease and a vaccine meant to defeat it. In this age of information and technology, with social media lurking behind and ready to plunge and destroy the innocents, how I wish we have a good fairy to bestow the gift of education and conscience. Dengue is a disease that has pandemic proportions. It has increased 30 to 50-fold in the last 50 years. It is spreading uncontrollably, and mosquitoes being part of nature may never be eliminated. Dengue causes 390 million infections, with 80% mild or asymptomatic, but can transmit this disease. 20,000 deaths yearly in the world today. But facts like this and education alone are not enough. There is a gap to fill in order to successfully combat misinformation, the lies, the myths that are spread leading to vaccine hesitancy. We cannot mandate, but there needs to be a learning from the masters, from Heidi Larson, and from the experiences that we have had. We need to listen to capture the moment for engaging people and communities. We need to understand their values, their problems, their pain. And sometimes then we can try to find solutions together and maybe recommend, not mandate. Let the solutions come to their attention, just as we see the increasing burden brought about by the disease and continuously seek for the right answers. Bridging the gap may be difficult, although sometimes a good leader is all what we need. A leader who understands the science and ready to make policies based on science. Perhaps we need educational materials to be readily available and accessible. You know, this reminds me about a recent conversation I had with a pediatrician who told me how the community appreciated the work she did with a school teacher doing the school-based dengue vaccine immunization program in their community. She tells me that during the 2019 dengue epidemic, their community and the school children were spared. And that is the positive experience that we are really looking for. Thus, it cannot be overemphasized that in the introduction of a dengue vaccine, this is a report from the International Vaccine Institute, the Dengue Vaccine Initiative, and the Dengue Prevention Board in 2016, that the priority is placed on advocacy and communication over all else, all those important and essential activities, which we always say, okay, post-introduction safety monitoring, surveillance, implementation strategies, and even funding mechanisms. Advocacy and communication is what we need. And we need strategies and solutions that are innovative, creative, and collaborative. And so, to all of you there, what is a better way than to bring world attention to the burden of dengue? And together we find solutions to defeat it. This is what World Dengue Day is all about. And we do hope to get the United Nations appreciate and declare this. Thank you very much for your attention.
Thank you very much, Professor Bravo Lulu, for that. fascinating insights into the journey of the Filipino vaccination program, the evolution of that. And you alluded to some really interesting points in terms of moving from a prescriptive to a more grassroots community-led impact or development of vaccination programs based upon the actual needs of the people. I think that's a fundamental change and something that was kind of highlighted by Jean-Antoine and some of the on-the-ground work that was being done there. Thank you very, very much for that. And thank you very much for mentioning the World Dengue Day as well. Really happy to have you on board our dengue advisory group, Lulu, as well, for valuable input. And it's really something we're trying to push. So thank you very much for that. You mentioned misinformation, some of the gaps there. And I think that brings us nicely onto Dr. Angus Thomson, who's now one of the senior advisors for the demand for immunization at UNICEF. So I'd like to say welcome to Angus. Nice to see you. And I'll hand over the floor to you.
How do you do, everybody? As Cameron noted, I'm Senior Social Scientist at UNICEF in the Demand for Immunization team. I joined the team earlier on this year, just at the beginning of the COVID-19 pandemic. And while I've worked on vaccine confidence, hesitancy from many different directions, I've been very much focused on misinformation and disinformation since I joined UNICEF. We're developing a global program that aims to provide the tools, the training and competencies, the resources that a country needs to implement a misinformation management strategy. And I'll get to that, but I just wanted to give a little bit of background first, although I just wonder whether it's really necessary for everybody because we've all been living this pandemic from day to day. From the very beginning, we saw this, what Tedros called the infodemic, an infodemic emerge in parallel with the SARS-CoV-2 virus spread. A huge explosion of misinformation and, more importantly, disinformation. Disinformation is deliberately created, engineered misinformation, designed and crafted to manipulate people's perceptions and created for generally nefarious purposes. And it's a very important distinction. We've seen both misinformation and disinformation explode. And vaccines have been inexorably drawn into this misinformation storm, this perfect storm of disinformation. I show you one example that came up quite early in the pandemic. I'm focused on supporting countries in West Africa at the moment, in addition to other countries around the world. And we detected very early a rumor that began in Madagascar or the Comoros Islands, we're not sure which one, and that got rapid traction, spread throughout the Francophone world, throughout Francophone countries in Africa. Was given oxygen by 2 French doctors who discussed testing candidate vaccines in Africa. And this narrative, this disinformation narrative, pivots around the idea that a SARS-CoV-2 vaccine was already being trialed in Africans. Sorry, I've got a thunderstorm here and my door's banging. Was already being trialed in Africans in April. Obviously, there was a level of resonance, a level of plausibility here because of the historical context, and it was given just enough plausibility in other aspects that it got great traction. It spread through a number of countries. It was adapted and tailored to countries. I'm going to have to close my door. Sorry, folks. Things have just hit here in France.
It's the joy of webinars.
It's always fun working from home, isn't it?
Yeah.
If it's not a kid, it's a thunderstorm. So next slide, please. And these narratives, these rumors, these conspiracy theories, obviously spread both online and offline. But it's important to acknowledge that online social platforms have been also engineered or designed to facilitate the spread of information and therefore of disinformation. They are addictive, attractive, irresistible by design. They are literally addictive because Facebook, for example, and here's a quote from the first president, knew from the very beginning when they were trying to come up with a process, a tool that would consume as much of your time and conscious attention as possible. They understood that every time someone liked or commented on your photo or post, that every time you saw some outrageous piece of misinformation and you clicked to find out whether it was true, that you were getting a little dopamine hit. And this is the same neurochemical feedback loop that you get for drugs, for all sorts of things. So they knew what they were doing. They're exploiting a vulnerability in human psychology. Therefore, these platforms are designed to spread the disinformation that is designed to attract your attention and to encourage you to share it and to have some kind of an influence on your perceptions, on your attitudes, on your beliefs. The other thing about social platforms that's really important to bear in mind, and I could talk about these, I mean, we know that misinformation spreads faster than reliable information, et cetera, et cetera, et cetera. But talking to each of you as individuals as well, anyone and everyone can be a super spreader on social platforms. So one study of Twitter found that 60% of everything that was shared by people in that sample had never been viewed. People hadn't even looked at it. And so what we have is unintentional misinformation, sometimes a lack of information, intentional disinformation that is then being either unintentionally or intentionally shared. And through this system is potentially reaching many, many people in a very short time. Next slide, please. And so if I left you, so the first thing I'd like you to remember is that you're all potentially super spreaders. So please stop and think before you share anything in this COVID infodemic. The second thing that I'd like you to remember is that if we are to manage misinformation at a national or subnational level, it's all about strategy. This is a very nice study of the vaccination conversation on Facebook. Johnson and colleagues looked at pro-vaccination sites producing pro-vaccination content, vaccine critical sites producing anti-vaccine content, and most importantly, those neutral sites, people who don't yet have a position on vaccines. And there's some really interesting conclusions in this publication, and I'd encourage you to read it. But the most important one for me is that the pro-vaccine pages are talking to themselves, whereas the anti-vaccine pages, and many of whom are anti-vaccine entrepreneurs, we know that this is, in a recent study, was estimated to be an industry worth about $1 billion a year at least on the social platforms in terms of advertising revenue on these pages and other sources of revenue. The anti-vaccine pages were effectively reaching out to those people who are undecided, interacting with them and drawing them into their groups. So while they have a clear strategy that is effective, the pro-vaccine pages are still basically operating on a seems like a good idea to get some pro-vaccine content out there strategy instead of a proper integrated social media outreach strategy. Next slide, please. So when we're thinking about the impact of COVID-19 on immunization programs around the world, I like to work around 4 themes. The first key theme is what we're talking about right now, disinformation. So tracking and assessing and potentially responding to rumors, to disinformation in real time. We also need to be looking ahead to the introduction of new SARS-CoV-2 vaccines. and understanding the impact of that misinformation, the impact of health authorities' responses to the COVID pandemic. I think we heard from Heidi, for example, that trust is fundamental to vaccine acceptance. And so if trust has been eroded, for example, by other responses at a national, but from health authorities to the pandemic, it can impact people's perceptions and acceptance of vaccination. But also, more importantly, more broadly on, we can understand through a social listening approach the impact of this pandemic on provision of or access to immunization services, and more broadly on hesitancy, confidence, demand for vaccination. And so the third point I'd like you to remember is that while we see this infodemic, while we are easily distracted by this sensational, outrageous disinformation that is designed to attract us, to pull in our attention, to make us click, the biggest game that we have to win is reaching those people through that haze of disinformation, those people that Jean-Antoine was referring to through the listening program that they've put in place in the Philippines, the people with perfectly natural questions, concerns about immunization, vaccines in general, and of course, more specifically about the upcoming SARS-CoV-2 vaccines. We have to understand their concerns, their questions. We have to reach them with responses that allay those concerns, that they trust, and that they incorporate in their knowledge and into their decisions to get vaccinated. And that is the biggest game that has to be won ahead of us. But in parallel, we have to be working on these disinformation, misinformation narratives that are circulating. Next slide, please. So UNICEF is spearheading a broad partnership that aims to, as I said at the beginning, provide countries. So this is not a global initiative. This is an initiative that aims to provide resources, support, capacity, to build capacity at country level to start to implement an effective social listening and engagement strategy. We're partnering with Public Good Projects, which is a US NGO that has already developed a social listening platform that's being used by over 150 local public health departments in the US. First Draft, another NGO that's been working on misinformation, is a leader on misinformation for at least the last 10 years. And the Yale Institute for Global Health, which is a center of expertise in the behavioral and social underpinnings, determinants of vaccination behaviors. But we're going to be working in close coordination through the Vaccination Demand Hub that some of you may have heard of, to ensure that all of our partners, the WHO, Gavi, the US CDC, the Bill and Melinda Gates Foundation, but other partners as well, are coordinated, that we coordinate everybody's work so that we're all doing what's necessary to bring to countries, in particular, these three big pieces that would make up an effective social listening and engagement strategy. The first piece is a tool and technical support to start to do that social listening and analytics. And I'll come into this in more detail on my next slide. The second piece is actually developing the competency, the capacity to manage and use those tools, and to be able to transform the data that is captured and visualized into actionable insights. These infodemiologists is the word that was coined during a recent conference convened by the WHO, or social analysts are really, as a good colleague from the CDC calls them, unicorns. They are a multidisciplinary function. They need to have public health, they need to have data analytics, they need to have communications, risk communication, community engagement experience. So we're looking at how we can build that competency at a country level. And then the third piece is the Digital Interventions and Assessment Lab, which will be aiming to develop. So I'll come back to this. We have a lot of evidence to show that the content that we often create to promote vaccination may be ineffective most of the time, and may actually backfire, in particular in people who are hesitant. So this lab will be designing developing rapid testing, messages and narratives for efficacy and safety. Next slide, please. I'll just go into these 3 points in a little bit of detail and then hand over to questions. The idea of the social listening system, so it's not a social media listening system, it's a social listening system, pivots around the understanding that organizations like UNICEF and many of our partners are accessing at a country level all sorts of different conversations, all sorts of different data sources that would help us understand where the public is in relation to immunization. Of course, there's traditional media that can be easily captured digitally. Most of it is online. There's social media, the classic channels, the Twitter, Facebook, etc., etc. These can be accessed, but there are also there's other content out there. There's unique sources of insight, of data. For example, U-Report is a system that UNICEF has that it operates in 65 countries through smartphones, connects with a largely young demographic, can push information to that demographic, but we have a chatbot on there. That chatbot is also has a rumor reporting mechanism, function, and so we're capturing rumors from the field through that. But there's also the kind of work, the kind of studies that Heidi presented today. So surveys, polls, behavioral insight studies. We need to be able to consolidate that insight as well. Community feedback, which is often offline. This is what we hear in communities. And so we're designing a cloud-based platform that will allow us to acquire and aggregate all of this data. We'll be developing the filters, the algorithms that make sense of this data, and most importantly, co-creating a dashboard that will effectively visualize the data, because data that doesn't tell a story is of no use at all. And that dashboard will be then used by the infodemiologist to develop the insights, recommendations that will be fed into the risk communication, community engagement activities in the field, communications, advocacy, social mobilization, etc. That's the first moving piece that we're developing. Again, this is not a global system. This is a system that we will be tailoring to each country. The next slide, please. And then I put in the Digital Interventions Lab because I think this is something that we've desperately needed in immunization for decades. I think, as Jean-Antoine alluded to, it's important to be able to provide people with reliable scientific information. But what we do know is that once somebody is already hesitant about vaccines in general, if somebody's been exposed to disinformation that's giving them misgivings, that's generated misgivings, the content that we generally provide can backfire. There's a number of studies now. What I show on the right there is a study of US CDC content, which have shown that while we achieve a communication objective, we can fail in our behavioral objective with content that is designed to increase people's acceptance of vaccination and vaccination rates. In this case, a scary photo of a child with measles made all parents agree that measles was a dangerous disease, but the parents who were already hesitant actually showed a decreased intention to vaccinate their children. So correcting information can backfire. The second point here is that the decisions that we make around vaccines can have varied and very deep social psychological roots. They can be affected by our thoughts and feelings, by our attitudes. They can be affected by heuristics, cognitive biases, omission bias. I prefer to fail by doing nothing than by doing something, for example, confirmation bias, I'm sure many of you know. But it can run deeper. It can run, as we heard from Heidi, run as deep as the trust that we have, not just in vaccines, but in the health authorities that provide those vaccines, in the governments themselves, social norms, our beliefs, right down to our moral values. And we've identified 2 moral values in a number of studies that are consistently correlated with people's decisions to vaccinate, which means that the content that we generate needs to be designed based on that understanding and on the local understanding of what's affecting people's decisions. It needs to be rapid tested to be sure that it's effective and safe before we implement. The other piece that I didn't put a slide in here, but the other piece that's very, very interesting here is that we have an emerging field in communication science of inoculation against misinformation. So we are beginning to understand how we can actually inoculate people against misinformation in general and against specific disinformation narratives. We can do this in the way that we present the information. Obviously, one of the key principles is not to repeat the myth too often, because people confuse familiarity with truth so very, very often. But we can further inoculate people by highlighting the tactics of the authors of that disinformation, or even highlighting the underlying motivations of the authors of that disinformation. I've already touched upon the fact that there are many now anti-vaccine entrepreneurs who are making money. Vaccination disinformation has been used over and over to monetize, or to politicize, or to polarize societies. But there is always an underlying motivation when disinformation is being designed and disseminated. And so the idea is also to build in this inoculation approach, moving from debunking myths to pre-bunking myths, and setting up this lab so that as we receive requests from countries, we're able to rapidly develop, test, and provide content that countries can then further adapt and implement. We'll also be providing monitoring and evaluation metrics to enable countries to track the impact of what they're doing. Next slide, please. I think that's it. So I'm going to stop there. I'd rather have questions than talk too much. I'm open to answering any questions. I can talk about this subject for hours. But if there are three things that I'd like you to remember, it's that to tackle misinformation, we need to have a strategy. It needs to be done in a structured, integrated way that mobilizes everybody. That when we're listening in to the conversations, there needs to be an understanding of the inequities of people's access to digital information. So the system that we have has to be accessing the conversations where they're happening, whether that's online or offline, and that the content that we provide can backfire, and therefore we need to think very carefully about the content that we create, and that content basically needs to have the same development process that we do for the vaccines that we deliver. That content needs to be tested. This can be done rapidly for safety and efficacy before it's put out there, because it can backfire. Thank you.
Thank you very much, Angus, there for that fascinating, very exciting presentation, actually. This tool set in terms of the Vaccination Demand Observatory was like an amazing project. I'm sure you're going to get a lot of feedback from that presentation. You mentioned behavioral science. Now the WHO have just launched their formal behavioral insights unit a couple of weeks ago. So this whole area is really taking off, and we've really watched that happen in the last 5-6 years. The British government have their own nudge unit in terms of behavioral insights. We've worked with them ourselves on a couple of projects. So it's fascinating to see it all come together. And I'm sure you're going to get a lot of questions in the Q&A. Thank you very much for that presentation. I just want to say, before opening the Q&A, I'd like to bring in Dr. Derek Wallace, if possible. Yeah, hi there, Derek. I know you didn't have so it's Dr. Derek Wallace, the Global Dengue Program Head at Takeda. I know you didn't have a presentation to give and you want to be part of the panel, but do you just want to introduce yourself very quickly, and then I'll convene everyone for the panel?
Yeah, no, great. Thanks, Cameron. It's fantastic to be part of this group. I really enjoyed hearing these presentations. I think key to vaccines, many of the principles that have been described are really clearly important in how we get the best out of a vaccine and how we ensure that the public health benefit of the vaccines we produce are maximized. I think that there are kind of three main factors, I think, in terms of maximizing the public health benefit of any vaccine candidate. And clearly one of those is linked to the topic of this presentation, which is really around understanding the barriers to vaccination. And that includes understanding which factors contribute to vaccine hesitancy, or maybe maybe reframing it in the way that Heidi did, the factors that contribute or promote vaccine confidence. But I think that as a vaccine developer, we have to go back to some of the science, and I totally acknowledge what Angus said, that sometimes correcting facts can backfire, and it's clearly more complicated than just clear data. But we have to start from clear data to understand how a vaccine can be used. And so as a vaccine developer, particularly with our dengue vaccine candidate, we've really focused on generating as clear and as transparent data and granular data as we can on the safety and efficacy of our vaccine. Once we get to a situation where the vaccine's licensed and it's available for use, I think dengue is very complicated, and you know, I don't think a dengue vaccine is going to be sufficient. Dengue is also a disease that can affect a wide range of ages, so it's going to be very difficult and very local to understand how best to implement a dengue vaccine program and how best to assess how that dengue vaccine program is working in the context of other dengue vaccine interventions. So vector control, classic vector control, novel vector control, which I think is the topic of the next session, but also activities like WASH. So I think that, you know, that's those three factors I think are really important. Understanding the barriers to vaccine uptake and vaccine confidence. Ensuring that we really understand what a vaccine does in terms of safety and efficacy, and then working out best to implement that vaccine in a very complex real-world situation.
Thank you very much for that, Derek. It's much appreciated. Could I ask all the panelists to come back on screen, and we can just thank you very much, Jean-Antoine, Lulu, Angus, and I think there's Heidi there. So, I mean, we're getting quite a few questions coming in. I'd just like to ask a question firstly, just going back to Jean-Antoine and Professor Lulu Bravo. You both kind of charted the dip in confidence in terms of vaccine confidence, hesitancy in the Philippines, and then it's the rebuilding process. And you mentioned, Jean-Antoine, the listening, the science-based communication, and the kind of whole of society approach. You mentioned the education sector, well, the partnerships at education level, and this youth patrol engagement. What I wanted to ask you both was, do you think, has COVID, obviously when COVID's happened, it's really, everybody's become a public health expert overnight, that everyone's involved in, every lay public person is now talking about transmission. They're doing things to halt the transmission, the social distancing. They're being compliant. They're more aware. Has that helped rebuilding trust? Ironically, has the COVID situation accelerated this rebuilding of trust? I'll go to Professor Bravo first.
Thank you, Kamran. Actually, this is usually the first question on a media press conference that I get. Will the COVID vaccine go the way of Dengvaxia? I mean, I will usually say wrong question. But, you know, Dengvaxia went through a process, a long process of vaccine development. It went through proper channels and development. Now, people hear that, you know, even in the US, right, Heidi? Even President Trump is saying, you know, we're going to have this license, we will have all this. And even our own president tells us the Russian vaccine will be coming in and you can use it as soon as it comes. I will give it to the poor. I will give it, you know, all these things are really not getting to be kind of, you know, leading to trust for vaccines. So what we usually say is, please, can we stop the president from saying those things? And if we can give him a script and say that COVID vaccine, we must trust our scientists. We must trust our FDA. We must trust all the investigators that will come in. And all those people who are not experts must not be believed. I guess it will come, it will have the confidence will come in as soon as they realize that indeed the COVID vaccine trial will go the way of good vaccine development. And we're going there.
That's good. That's good to hear. Jean-Antoine, to you, in your kind of grassroots experience of working with those communities in the Philippines, and seeing that evolution, how has COVID affected that for you?
So I think I mentioned one aspect of the quote unquote positive influence of the COVID situation on immunization is the fact that people realize the value of vaccination. And we have as an example the enthusiasm and of the people for flu vaccines. And this is a worldwide phenomenon. It means that people understand the correlation between COVID-19 and these respiratory infections and all the comorbidity as well. And we observe that also through the increased demand of pneumo vaccines. Having said that, there is another aspect of COVID that is somehow positive, which is the lockdown. Because people are in their house, they have nothing to do. So when you propose a webinar, they are very pleased to have this, distraction. So that's helped us conveying some message through the webinars and the success that we are observing with several initiatives. I think it's partially due to the COVID situation.
And just to pick up on your journalists, partnerships with journalists, and how important you found that. How critical is that moving forward? Does there need to be some kind of embedded journalism in the development of vaccines? Would you advocate for that?
I can see that Professor Lulu Bravo wants to talk, so
Right, yeah.
Go ahead, and I will talk after.
Actually, immunization really is getting to be better now. I agree with you that, in fact, there could be a positive experience here. People want to get more, protection at this point, and government really have been working together with other NGOs, right? We have been working not just with our NGOs, medical societies, because we are in a very precarious state in the Philippines because of the low immunization coverage and because of the 2018 vaccine hesitancy that occurred. We did have the polio outbreak and measles outbreak last year, and we are just completing the campaign to really remove polio again. And now here comes the COVID. And we have not really restored yet, our immunization coverage before the COVID strike. So it's really difficult to go up again. But I know we will do it. We will try our very best with the help of all. And even Heidi, Heidi, you're always mentioned in many of the lectures that are ongoing, both among the adults, the pediatrician, even the obstetrician, about vaccine confidence.
We won't be successful in launching a COVID vaccine without having the media and the journalists well informed about what's going to happen. Because we all know that there won't be vaccine for everybody, and people need to understand how you prioritize the use of this vaccine. And this can be done with the support of the media, with the support of the journalists. So they will play a critical role, and they need to convey the very same message. And this is why the platform that we are supporting with Professor Lulu Bravo is critical, because through this platform, they have access to the expert, and the expert equip them with the right level of information. And then they use this information in their papers, when they talk on TV, etc., etc. So they will play a critical role if we want to have a successful launch of the COVID-19 vaccine.
That's fascinating. And just extrapolating on this concept of journalists becoming critical players in all of this, one could argue that today's news, that today's journalist really is Twitter, is your Twitter feed, or it's your Facebook feed. So this question goes to Professor Larson and Angus, Dr. Angus Thomson. What role, if any, or what type of responsibility does the social media provider, the Twitter, the Facebook, have in all of this? I know Facebook have put something out about COVID misinformation and not allowing stories to run, but what's your view on that? What role have they got to play in this?
Oh yeah, I'll kick off, and then Angus, I'm sure you've got some views. Well, I think they have a role to play, but in the same way that we can't wag our fingers at journalists, we can't blame it on social media companies. I think we could shut down Facebook tomorrow and the sentiments behind these issues will not go away. I'm not saying they don't have a role to play, and they're very conscious of that. I mean, they know at a very basic business level it's having huge reputational risks, but I think that there's quite a few people inside the company who do care. I think what they're trying to do, though, is one, you know, through their relationships with UNICEF and WHO and Gavi and, you know, and a number of different credible health authorities, they are trying to bring the, you know, the credible sources farther up on the search terms and divert things. But I think what I really liked about one of Angus's slides was recognizing the ecosystem, and because right now there are so many other options that, you know, there, and the risk, and we see this even in our, we've been doing this, you know, social media and aside from the survey work, the media monitoring for a decade, and what we see is that, you know, a lot of these sentiments have already moved off of the online news media. Now, when our searches, our routine searches for vaccines are primarily showing up on business pages on the news media. It's all the emotions, all the sentiments, all the opinions have moved into social media. And as the restrictions are coming, they're getting pushed down into darker spaces that are much more open. And then also, I think the point that it's not just about social media, because we see in Africa, people will take a picture of a WhatsApp image on a cell phone and, you know, show it on the evening news or read it from, you know, the imam from the mosque, or, you know, talk about it on the radio. So there is kind of other kinds of amplifier effect. I think the social media issue is the speed and reach and the simultaneity of it.
Yeah.
But I do think in getting some of the resilience around it is really important. And I think it's just all of these efforts need to be happening. And I absolutely agree with Derek that, you know, we can't throw the baby out with the bathwater, and in trying to make sure we kind of make it relevant and acceptable, that we lose the basics of the science. Because the other risk with COVID, and then I'll turn over to Angus, is we shouldn't be, I mean, we don't even know a lot about COVID. We are learning every day about this virus, which I tell you, it is way not the flu. It is a really serious illness. It goes on. We don't know some of the longitudinal effects. So for us to be, I mean, we have to remember that, you know, WHO has rumor archives in their basement from, you know, rumors were a valuable way to early detect disease outbreaks. We may be detecting new symptoms. You know, we should be careful what we're deleting when we don't really know all the information. So it's complicated. They do have a role to play. Short answer to your long question, and my long answer to your short question. But I think we have to be careful with, you know, I think we all have to look at the multiple players and responsibilities we can have.
And I suppose avoiding the censorship road, the road to censorship is the primary thing there. But thank you very much for that answer. I mean, to you, Angus, in terms of you've got a framework there, this observatory, the tool set you're building. Would there be a home there for Twitter or a home there for Facebook to engage? Would they be a potential partner?
Yeah, potentially. I mean, we're collaborating already with some of the platforms on specific projects. I think, you know, Heidi's point is an important one. Social media is not the only place people are. Okay. That said, disinformation. These platforms were designed in a way that they accelerate the spread of disinformation in an incredible way. I mean, they are hijacking our neurochemistry in a way that leads us to spread the disinformation. So they have a clear responsibility to make systemic changes to those algorithms. One, so reducing the ability, people's ability to just transfer messages. From 20 people to 5 people can have a huge impact, especially during a crisis. They have a responsibility to remove disinformation. And so a recent study involved a kind of a survey of disinformation on one platform that was all reported to the platform, and it was clearly vaccine-related disinformation. And months later, 95% of that disinformation was still on the platform. It's being reported and nothing's being done. So I think that needs to be turned up, because there are serious health consequences, public health consequences, if that misinformation stays on there. There are other things that can be done. Most of the platforms are now putting good information up front, and I agree with Derek. The science is everything starts from the science, directing people to the good information. But they can demonetize these anti-vaccine entrepreneurs. They can deplatform them, and that's happened. But maybe it's not happening enough. So there are things they can do, and they have to play a role, just as everybody has to play a role. Just as Jean-Antoine said, this is a holistic approach. Everybody has to step up here. The stakes are too high for it to be left with, governments or global organizations or, whatever. But I think it's the point that these conversations are happening in lots of places, Cameron, is super important too. And so, the first step in developing a strategy is doing an assessment of your information ecosystem. Where are the conversations? Who's having them? Who are the influencers? What's circulating? What are people saying? And it's in different places, in different countries, in different regions, in different districts. And that's a fundamental step, rather than just leaping in and assuming that everybody's on Twitter.
On the basis of that, and something that Jean-Antoine highlighted in his slide deck, the local champion. And I'd like to ask this to Derek: how important is it going to be for someone like Takeda or someone in this space to developing local champions in terms of the advocacy around, vaccination?
I think this is absolutely key. The specifics of dengue epidemiology change over time and in location. And so understanding how best to implement any of the different tools for dengue control is really going to have to understand the local context, but also trust begins locally. And I think you've nicely, Angus, sort of highlighted the difference between disinformation and misinformation. And one of the things that worries me is that dengue is a poorly differentiated disease, and the vaccines that we've got are not perfect vaccines. So in that context, I think diagnostics and vaccine registries are really important, because we won't be able to differentiate misinformation from disinformation from fact if we don't know who gets vaccinated and whether they have a febrile illness, which is actually dengue or not. And so I can see a number of different situations where, somebody who is hospitalized with severe dengue but did never receive vaccine still creates a significant local concern, which can become quickly a national, international concern based on an event which is actually not based on fact. Likewise, and that comes into vaccine registries. Likewise, I think you can have people who are vaccinated who have breakthrough disease, but is that breakthrough disease actually dengue or not? And for that, good diagnostics are important. So I'm kind of answering two different questions here, Cameron. I think that the local activities are really key, because that's where trust is, and also where understanding what kind of dengue tools are most relevant for that local context. But I also think that in order to avoid local events becoming things that are kind of outsized impact events, we have to have a good understanding of who's vaccinated and what disease is actually dengue as opposed to non-specific febrile illness. So I think that there are two aspects that are really necessary as we look towards sort of larger scale, a potential future world with larger scale vaccine implementation.
On that, thank you, Dr. Dave. On that future world vision, if you want to call it that, do you think there'll be a point where the likes of Sanofi, the likes of, this is to Jean-Antoine as well, Sanofi, Takeda, they would partner around the community engagement programs? Because it's the same community of ill people.
Yeah, I think partnership is key. I don't think that anybody can do this on their own. I mean, look at the new, Professor Bravo mentioned the Wolbachia technologies. You know, how do these interact with vaccines? How do we look at this long term? And these things can't be done by any individual group. I think it involves the organizations at UNICEF, Heidi's group, Vaccine Confidence, in governments, education ministries, environmental ministries, health ministries. It has to be a partnership. And of course, the key one in all this is communities.
Yeah. And I was going to ask you, Heidi, about the religious leaders. I mean, is it too far gone, or can they be harnessed in terms of, they've got great community outreach, they are fundamental players in these communities. Can they be harnessed in terms of, in your opinion, can they be brought into the fold somewhat?
Yes, absolutely. And but I think the challenge is, I mean, where we need to bring them in is very early. I think when I was still at UNICEF, convened a big meeting of religious and traditional leaders across Africa around vaccines and immunization. And I remember, I think it was the Archbishop of Nigeria, and he pulled me aside and he said, you know, Dr. Heidi, you UNICEF people and, you know, others give us good words. We put them in our microphone, as you know, no problem there. But you're missing the most important value that we have for you. And that is, we know the good days, the bad days, the ups and downs of the people in the community. We know, you know, when they're happy, when they're sad, what works, what doesn't.
Yeah.
So come talk to us much sooner, because, you know, we can, don't wait for the megaphone. And I think that was something that has stuck with me ever since. And they can absolutely, because we have to remember, you know, most of the religious incompatibility is, I don't know any religious texts that explicitly have an issue with vaccines.
It's interpretation. Yeah.
And so, you know, you can find the supporters, and there'll be a few outliers, but I think we need to collaborate with them much earlier. They can have a lot of trouble if they don't. Yeah. The Kenya experience, we've seen, I mean, the Catholic Church was historically involved with a lot of immunization campaigns. The year they weren't invited to be included in it, woo.
Yeah. A very interesting asset. Yeah. Yeah, a very interesting asset. I mean, I'm being asked now that we're coming to the end of the session. I wish we had longer to discuss, but there's so many points to unravel and unpack in all of this. I'd like to give a large thank you, a round of applause to all of you, to Derek, Angus, Jean-Antoine, Heidi, and to Lulu as well. Thank you very, very much for attending this session. There are a lot of questions coming through. We haven't got the time, so I'm going to have to, if it's okay with everyone, I can always condense those and send those over just so you get a flavor of the questions that are coming through. Thank you very, very much. And I hope you can join us for the next session, which is going to be innovation in vector control, which is going to be in about 12 minutes from now. Thank you very much, everybody. Okay.
Thank you.
Take care. Bye-bye.
Bye.
Bye-bye.
Bye.